Hey everyone, before we get started, take a second to like and subscribe to the show.
It's the best way to help us share great information with more people. Thank you. If you have ever lined up your person's pills for the week and wondered, do they really need all these? Then this episode is for you, because we're talking about the real world risks of too many medications and how to safely simplify it.
We have here with us today Dr. Reshma Kapadia. She is a graduate of the University of Texas Doctorate of Pharmacy program. She's been a practicing pharmacist for over 20 years, and she has a real passion for helping older adults navigate the world of pharmacy to decrease overuse of medications that can contribute to adverse events and outcomes. She's an incredible educator, she's an incredible advocator, and we are so excited to have you with us today. Thank you so much for being on with us.
Thank you guys so much for having me. I'm excited to talk about this topic.
Yeah, absolutely. And I should say, before we dive right in here to this exciting topic we're going to be talking about today, which is the idea of polypharmacy, which we're going to define in just a second here. We have a couple of other really great episodes that we have recorded with Reshma in the past. So if you have an interest in pharmacy, we did a great episode on supplements. We did a great episode on side effects and adverse reactions. So definitely go out and check out those past episodes. Dr. Kapadia is absolutely an incredible expert on these topics. So with that said, can you tell us a little bit about what the heck is polypharmacy?
Yes. So polypharmacy is the use of multiple medications, which can include over-the-counter medications, supplements, alternative medications as well. So typically it's defined as the use of 5 or more meds, and hyperpolypharmacy is the use of 10 or more medications. Majority of our older adults, our geriatric population, is on 5 or more medications. It's very, very common in that population. And about 20% of adults are on 5 or more medications. So polypharmacy is very prevalent in the community right now. And as we know, the more medications you have, the more likely you are to get side effects, drug interactions, issues, med errors, hospitalizations. It can be a cascade of events and more medications added on as well because of polypharmacy. So yeah, it's a big cause, big definition, but definitely important for people to know. And the less medications we're on, the better quality of life we can have. So that's my goal as a pharmacist, is to make sure people are on the right medications, the effective medications, the least amount of medications that work overall for their best quality of life.
Okay, so when you said that polypharmacy is 5, the first thing I thought was literally everybody I've ever worked with has had more than 5 medications. And so is the definition saying that polypharmacy is bad, and we know that when you hit 5 or more medications it causes other problems? Or are we just saying, it's something to be concerned about, maybe to think about it? I guess what I'm saying is polypharmacy a diagnosis in and of itself that's hey, this is something we need to deal with? Or is that just the definition is we have a bunch of meds?
Right. And I think, it just depends on the patient. So definitely the more medications you are, the more possibility of issues that can occur. And then, of course, medications are necessary. They are needed for certain diagnoses to control symptoms, certain disease states. So yes, as a pharmacist, I do not recommend anyone get off their meds because they are on 5 or more medications, but just to be aware that, hey, the more meds I get on, the more possibility of drug interactions, which can then lead to a certain adverse event or side effect, which can then cause a symptom of me getting on another med, or maybe thinking, oh, I might be presenting with a new disease state, instead of looking at our meds and saying, is the medication causing my side effect? Or the symptom that's presenting. So really bringing awareness to that. I wouldn't say it's a diagnosis, but something to look at when we are on multiple medications, for sure.
So we often think about polypharmacy As you both know, I'll go and do talks on fall prevention, and polypharmacy is a risk factor for fall prevention or for falls. Polypharmacy can be a risk factor for many different things. Can you give some examples of what some of the common risks of polypharmacy are?
Yes, so a lot of things that can simultaneously present as a disease state as well. So being aware of that is huge as well. To always think, is my medication maybe contributing to the symptom that is presenting? So, like you said, falls is a huge one that leads people to hospitalizations and just adverse life outcomes. So definitely becoming aware. If you feel dizzy, confused, brain fog, sedated, you're sleeping all day, you just don't feel like yourself. That's a very common thing that I hear as well, is I just don't feel like myself. I used to be able to play with the grandkids, and now I just don't have that energy like I used to. Feeling faint, feeling dizzy, huge side effect of blood pressure meds. I'm definitely not telling anyone to get off blood pressure meds, but blood pressure meds can make us feel dizzy and faint, lightheaded. So, making sure you're on the effective dose, not a dose that's too high, because then your blood pressure can get really low and then cause other symptoms. Another big one is sleep issues, not being able to sleep at night, or just, having erratic sleep or sleeping too much in the day and not at night. Appetite changes is another really big one that we see with medications, especially when you're taking 10, 15, 20 medications. I mean, that's a lot of meds that your belly's getting full with just medications and you don't want to eat anymore. So we do see appetite loss. We do see increase in appetite is another big thing. Muscle pain is a huge one that we see with, especially with statin medications for cholesterol, because that's one of the big side effects of the statin drugs. Not to say that you shouldn't be on a statin, but there's things you can take or supplement with to prevent the muscle pain. So there's just a lot more. I can keep going when it comes to side effects that we're noticing that are pretty common with polypharmacy or multiple medication use.
The thing that stands out to me about that list of side effects from polypharmacy you just gave is that almost all of those could be attributed to something else very common, especially when we're dealing with as we get older. Because sometimes we just expect, like, I don't have quite as much energy. People don't eat quite as much. And maybe I'm achy because I walked more yesterday than I usually do, or whatever reason. I went to therapy or whatever, And so it feels a little bit challenging or complicated to tease that apart and not just poo-poo it to old age, right? Okay. When you really could be impacting it by doing something about it. So do you have any if somebody has that same thought that I just did, what would you recommend that they do in order to kind of pull those things apart from what could be normal to what could be polypharmacy side effects?
Yes, so especially when you start a new medication, be aware within the first week what you're noticing in changes in your body. So maybe keeping a journal of your medication list, and then how are you feeling? How do you feel after you take it? Because sometimes the symptoms can present within 30 minutes to an hour. Oh, I'm starting to feel dizzy. I'm starting to feel confused. I just feel like I just want to go lie down. When normally you don't. Normally you go out, you enjoy your day, maybe go to the gym, do things that you enjoy, and you're noticing a change in the way that your body's feeling. That's one thing I recommend is journaling. Having a medication journal is huge because that can really shine a light on side effects that are presenting. Now, some medications, we don't see the side effects until later, where, for example, the statin medication. They started the statin maybe 2 months ago, and now they're seeing muscle pain, but it's consistent. It's every day. Even if they work out, they don't work out, they took a long walk, regardless of what it could be, but the symptom is present, regardless of you resting or not, is another sign that let's look at our medications. Could that be contributing to it? So, really, being in tune with our bodies and knowing what it's telling us. And it doesn't hurt to ask a pharmacist or your doctor when you do see them that, hey, could you take a look at my medications? These are the symptoms I'm feeling. Could the medications be causing it? Always coming back to, let me just check. Is it my meds? Or is it something new? I think we forget that, and we really need to be more aware that medications are a big contributor to certain symptoms. And I'll just eliminate that before we add something. A lot of times we just want to go to the doctor and say, I'm having muscle pain. Can you give me a medication? And, we end up on more than, and that's what causes pharmacy, more than meds than we should. And now we start getting even more side effects of something else. Instead of muscle pain, now you're getting confused and dizzy because medications for muscle spasm, muscle pain can cause sedation, confusion, dizziness. So it's just a cascade of reactions that can occur as the more meds we're on.
I'm really curious, how often do you see polypharmacy occurring just because, like, maybe we start taking a medication in our 30s and we're still taking it in our 50s, even though, our bodies change. Like, we're not static individuals. We're constantly changing. Maybe there's a million things that can change about our bodies over a period of time. How often do you see polypharmacy occurring simply because maybe we're just sticking with the same old thing rather than having a conversation with our doctor or a pharmacist about it?
Yes, so that's something right now that I'm really big on bringing awareness to, because people think that once they start a medication, they have to be on it forever. And that's not always true of all meds. Now, some, yes, you do have to be on it forever. That's just the nature, because we do want to prevent morbidity, mortality. But some medications are just for and studied for a few months or a few years. It's not something that needs to be taken long term, and we need to evaluate, is it still beneficial to the patient? Now let's look at the risk versus benefit of them continuing. And if the risk of continuing is higher, then maybe we should consider a trial of stopping, or seeing how the patient responds without being on the medication. So right now we're seeing that medications are not being looked at to stop. And, our healthcare system is very overwhelmed. There's not enough time. People have trust in the system, which is good. They should trust the system, but not everyone is looking at what can we make sure is the best route for the patient. And sometimes the best thing for the patient is to look at their meds and say, okay, they don't need this anymore. They've been on this. PPI is a common one, which is a proton pump inhibitor for reflux, heartburn, common med that's used, and it's over the counter. Some of those products are over the counter, the pantoprazole, Prilosec, Nexium, and those are only recommended for 6 months, but people are on them for years, and no one's evaluating, is it still needed? And this is affecting their gut, this is affecting absorption of other nutrients, minerals, other medications that they might be on. So it's really affecting their body, and, bringing awareness to just the thought that let's do a med review. Let's look at all your medications, maybe every few months, and make sure that what you are on is needed and necessary, and you're not on anything that isn't necessary anymore.
I'm glad you said that last part about maybe every few months, because that was the question I was about to ask. Like, at what cadence should people consider talking to a pharmacist or talking to their doctor about, like, do I need to be on all these meds still? And so if it's every few months, should that happen with the primary care doctor? Should it happen with the pharmacist at Walgreens where I pick up my meds? Like, how do you think about that as like an ongoing maintenance thing for us as individuals to like stay up on?
Yes. And so that is what, drove my passion for what I'm doing as a medication management and deprescribing pharmacist, because I worked in nursing homes and assisted livings for over 15 years. And, working with the geriatric population, they're on 15, 20 medications, majority of them. And I, as the pharmacist, would look at their meds every month. That is a federal requirement that a pharmacist has to look at every patient's meds every month in a nursing home. And I then had the thought, well, if we're doing this for our nursing home patients, what about our seniors in the community? They need to have their meds looked at every month. And then going down the journey with my parents and their medications and all the errors that I found while they were going in and out of the hospital and with doctor's appointments, med changes. I realized that we not only need this for nursing home patients, we need this for all patients that are on multiple medications. Someone needs to look out for it, because it's very easy to have a drug interaction, have a med that's not taken appropriately, start experiencing side effects, and now we're adding more meds. Can we or saying, okay, they've been on this med for 6 months. Do we still need it? Can we try to DC it? So I definitely, my goal as a medication management pharmacist is to hopefully see the community patients every month to every quarter would be ideal, with their if they see their doctor often and their doctor has time to do that, that would be great. Unfortunately, the pharmacist at retail settings, they have a lot on their plate. They have, dispensing role, checking and filling. They have a lot on their side that unfortunately the time to do a medication review is timely. And I would recommend, reaching out to a pharmacist that does it as a specialty to look at their medications and have someone that's advocating with them, making sure things look good, making sure they're taking it right, calling that pharmacist and asking, hey, I'm experiencing this side effect. I'm falling, I'm feeling dizzy, I can't sleep, whatever it may be, and asking, hey, can you look at my meds? Because maybe it is the meds. Maybe it is. It may not be, but having a pharmacist check that before you go to your doctor, I think is a huge plus, because now you can go to your doctor with a recommendation from a specialist, an expert in medications, and say, hey, these are the meds that are causing this. Can we change it? Can we try to decrease the dose, take it off, or add a supplement, or add something that does help me that won't cause that, a lifestyle change, nutrient change, change in diet, exercise, something different that we can support the patient with.
How important is it, and you've talked a little bit about this already, but how important is it to make sure that you are working with a pharmacist, that you're working with your doctor in making these decisions, as opposed to just saying, oh, wow, well, I'm on a lot of meds here. I looked up on Google that some of them might cause these side effects. I'm just going to stop. Yes. Like, how important is that to be working with your healthcare provider versus just going it on your own?
Huge. Yes. Please do not stop medications. Your doctor prescribed them for a reason. And definitely talk to your doctor. Even as a pharmacist, I can't tell you to stop. I can give you a recommendation. I can say these are the things that are contributing. This is what, as a medication expert, knowledge, I have years of knowledge on medications and drugs and how they work in our body and all of that. And so I can make that recommendation, but ultimately it's your prescriber that will make the decision of what they feel is best. So I definitely do not recommend using Google, ChatGPT, any of that to look at your medications and say, okay, I'm just going to stop, because now you're might be putting yourself at risk for something else. So, and that's why as a pharmacist, I believe medications are important. They are necessary. My goal is to just make sure that you're on the right medications. You're not on something that's not necessary for you, that you're on if you're having the side effects, can we change you to something that's better or take you off and supplement you or make a recommendation that can help your symptom in a holistic way? So there's definitely, it needs coaching, it needs a guidance. It's not something that you should ever do alone or without the supervision of a professional that is knowledged in medications.
Can you talk a little bit? So you talked about some of the side effects of having a lot of medications, but it's also possible to have some side effects because you're not necessarily taking your medications the right way.
Correct.
And so, can you talk a little bit about the dosing and the timing and like why the time that is put on the label is important and like how to think through that?
Yes, I'm so glad you brought this question up because this is a huge, huge reason why medication errors and side effects occur. Medications are studied and dosing is recommended based on the way the medication moves through our body and how it works in our body. So, based on that, during the clinical trials, the research phase, medications are determined on how it should be taken. So, some meds are recommended 1 hour before food, some are with food, some are after food, some are at nighttime. So it can vary. And it's so important to read the label and take it that way because that's the way it's been studied to be the most effective. Sometimes we don't get either the education or we think that it's not a big deal. And this is, the misconception that we have right now in the industry because we are unfortunately just, presenting with the symptom and just giving a med as a Band-Aid and just lots of prescriptions are being written right now. It's kind of, in my definition, I feel like it's like we're just giving candy to everyone for, a symptom that they're coming with. And so they don't take it seriously. And I think we need to bring awareness that medications work in our body a certain way. And it's important to take it the way it's recommended. We need to review the labels, review it with, if you don't understand, with a pharmacist. It is very complicated. And this is one big reason why med errors occur. And med errors are one of the leading cause of hospitalizations right now, too. Mm-hmm. Because they do have side effects when you take it in, like you may double a dose because you said, oh, I forgot to take my morning dose and I'm just going to take 2 pills at nighttime. Well, now it's a blood pressure med and your blood pressure is really low and you fall and you break something and now you're in the hospital. So it's very dangerous to understand that medications are, serious and they're not something that's just taken lightly.
And that's true even for over-the-counter medications too, right?
Very true, because you may be on a prescription medication and now you need, you start taking something over the counter and they contraindicate or they contradict. And now you have a side effect or you have a drug interaction. So not everything over the counter, we have this misconception that everything over the counter is safe, but unfortunately it's not safe. Some of the medications, were prescription medications just 5-10 years ago are now over the counter. And so there's this thought that, oh, okay, I can just take an over the counter med just any way I want, but that's not true. They also have guidance and directions on the label on how you should take it. And it's very important to remember that, medications can interact with each other. So it may be interacting with the medications you're on. And a very common one is if you're on blood thinners and then you start taking an aspirin, that's very dangerous. So unless your doctor prescribed it, it's fine. But if you're using aspirin and you're on blood thinner, now you're making your blood even more thin, and that can cause other problems. So another big one is ibuprofen. Ibuprofen is not safe in seniors. It has a lot of side effects in seniors and can cause a lot of GI issues, gut issues. And I don't recommend that medication in seniors unless we have to and under guidance at lower doses. But that's a big harmful medication that also causes a lot of seniors to go to the hospital as well. And that's over the counter and used very commonly.
I did not know that about ibuprofen in older
either.
adults. I had no idea.
Yeah, exactly. It's things people don't know until they end up in a situation or have a friend or family member that ends up having a horrible situation due to it. So, I don't want to scare people, but it's definitely important to talk to someone, especially the older you get. You mentioned earlier that our metabolism or the way our body functions changes as we get older, which is very true. And especially in seniors, the way their body metabolizes medications, processes medications is a lot different than when they were in their adult years. And so remembering that, and that's why they are more prone to side effects or certain situations that can, like the ibuprofen, which can really affect them when in ways that they were able to tolerate when they were younger.
So I would like to double click on that a little bit, because ibuprofen and Tylenol and like Motrin or Advil, those are things that when we have a muscle ache or pain or a headache as a younger person, you just take them for that. And so over the course of your life, everybody has their one. They're like, I use acetaminophen, like that's the one that works for me. And so I could see myself getting to be 50, 60, 65, having some muscle aches, and like, let me just take a Tylenol. If somebody's doing that and ibuprofen is their thing, what is the line?
That's me. That's my thing.
Yours is ibuprofen, right? So
Yeah.
what is the line? Is it the retirement age? Is it 65? And like, when am I an older adult that I should be like, okay, it's time to like just rethink all of the stuff that I have been used to doing to take care of myself because my body is changing. Like, is there a time frame?
Yes. So, of course, everyone is different, but in the industry, it's 65 plus is when, make the recommendations of the list of medications that are safe or actually not safe in the elderly. There's a list out there called the Beers list. And so that's at age 65. Now, as you are approaching that age, yes, all of our bodies are different. We're all made different. So knowing your body, like we talked about, and as you age, thinking of other ways to support your body versus taking a medication first, whether it's, a heating pad, an ointment, a topical, there's lots of things, red light therapy. There's so much out there, natural ways that we can prevent certain things that But of course, yeah, we have a headache once in a while. I'm not saying don't take the ibuprofen for once in a while headache or muscle pain. That's needed. It's going to work. It's not going to harm us. It's when we get to doing it often, a couple of times a day, high doses, that's when it's more of an issue where we can start seeing the side effects. When we start having someone having a headache every day or pain every day, and they're relying on this ibuprofen now for that pain, and they're getting to these high doses of it, and now we're going to start, maybe seeing some GI issues. That's where we want to be cautious. So once in a while, it's fine. But again, I want you, if you're a senior out there listening, if you are on multiple medications, other meds, other prescription meds, and you are taking ibuprofen or acetaminophen, which is Tylenol, ibuprofen's Motrin, Advil, and you are on other meds, be careful, how much you're taking. Because there is limits on doses. I don't know what other meds you're taking. I don't know if there's Tylenol in your other meds, because that's another thing. Some prescription meds like hydrocodone, Vicodin, Norco, they all have Tylenol in it as well. So we want to be aware if you take pain meds already and now you're going to take Tylenol counter, now you're getting too much Tylenol in your body. So same with your ibuprofen. Are you on, Mobic or another non-steroidal anti-inflammatory medication? If you are, now you're doing duplicate with ibuprofen, and now you may see some side effects. So just be careful. And always, the pharmacist at retail is always available for those quick questions to ask them before if you're concerned or you just want to verify that it's safe based on your other meds.
I think that's such an important, real takeaway here from this, is because, clearly this can be complicated. There's a lot of information to know. That is why there are people like you out there who have doctorates in this, right? Who
Yes.
are really experienced, is because all of this stuff is really complex. And you actually probably don't, as a individual consumer, like I don't as an individual consumer actually want to be making all of these judgment calls on my own, because I just don't know. So I feel like, to me, the biggest takeaway is talk to your pharmacist, talk to your doctor. If you're on medications and you need to start an over the counter, call the nurse in your doctor's office, or go up to the pharmacy counter and say, hey, this is my med list. You can pull it up here. I also want to take this thing. Is that going to be all right? Because there's no substitute for asking a real expert whose job it is to just know the ins and outs of these things like the back of their hand. And it's beyond just the fact that, obviously it can save your health. There's a lot of peace of mind that comes from having that conversation, I think, at least.
Yes, I totally agree. I definitely agree. And this is why I believe that, pharmacists need to be out there, need to be coaching patients through this journey and making sure that they're on the right medications, that it is complicated. It's a lot. And that's what I saw with my parents' journey. And it can be very overwhelming. And when it comes from, like we talked about, how to take the med, drug interactions, duplicate therapies, side effects. Oh, I'm presenting with this symptom. It can get very complex. So definitely reaching out to your provider, making a list of current medications is huge, and keeping it with you is very important as well. And updating that list every so often as medications change is also a big deal. So having medication journal as well as the list are going to be huge things you should keep in your back pocket or on an app, and have it for referral, for in case you do need to you want to add a supplement, or you're having pain and you want to go to the drugstore to get Tylenol or ibuprofen. So yes, definitely ask an expert.
That's an expert. One more question, maybe, before we get close to wrapping up. A lot of people are starting to have access to a teledoc type service or a nurse line, through their insurance. Is that a good resource to be hey, I'm having some muscle pain and a headache. I just want to make sure it's okay if I take a Tylenol or ibuprofen? Is that a way to get some quick access?
I would have to defer that question just because I'm not very familiar with teledoc services, in the sense, is it a specific reason that they're calling in, let's say a cold? Then they may only address the cold. But I'm not sure. I'm, not very familiar with that setting. So you would, I don't know the answer to that. I would assume
That's fine.
you're going to just,
Yeah.
address the issue at hand. Unfortunately, same with the nurse. I think nurses are amazing and so needed and do great work, but they are more, as a pharmacist, we know our meds. We know how they work. we know the drug interaction on the top of our head. Now, there's some nurses that know this very easily because they're so experienced, they have lots of knowledge, they've worked in many different settings. But is it their specialty? No. As a pharmacist, this is what we know. This is what we've been trained on for 4 years. We've got a doctorate in it. So definitely, using the resource of a pharmacist or your physician for medication questions like that, I would recommend that. Just in my
seems like that's like what you're saying is that's the safest way to go. Your primary care doctor knows you. They should know all your meds. Your pharmacist is the absolute like end all be all expert of medications. That's your role in the healthcare industry. And so those are your safest bets is what it sounds like.
Yes. And so as a pharmacist, I can't diagnose and I can't do patient care. So, I'm not going to be able to do what a doctor does with diagnosing and figuring out what's going on with the disease state. I can help with the medications. And as a nurse, she does the patient care, which we have not been trained in. So, I respect everyone's expertise and I recommend we collaborate together versus, say, oh, you're the nurse, so you look at my meds, which she may not be able to see everything that a pharmacist sees. Just as I wouldn't be able to see everything she's able to do through her training.
Yeah, that's a great point. Well, I think we've come almost to the end of our time here. I feel like we could talk to you forever about all of the things, and I hope that you come back to join us on CareLab here again. Until next time, though, Dr. Kapadia, where can people find more from you?
Yes, so my email is Reshma, RESHMA, at WiseMedRx. And we are about to launch my website, www.wisemedrx.com. So
awesome.
Well,
listener, if you made it to the end of this episode, we're so glad that you came on with us. And we're so glad that you're going to be a resource for everybody, especially when your website goes live. And so I hope that people will connect so that they can get expert guidance and advice to their specific needs, because all of what we just said is very general, and so you need somebody to look at your meds and your situation very directly before you make any changes. But one thing you can change is leave us a review and follow the episode, follow us on all the things that you listen to, so you can get more of this content, but also so that other people can know that we're existing and getting this great information too. And so until next time, everyone, we'll see you.
Bye.
Thank you. Bye.